Welcome to yet another episode of the Health Coach podcast with me, Joan Kansime. On this podcast, we have expert guest conversations on all matters health and lifestyle. We're getting back into the topic and starting from where we stopped. We stopped when Madame Tina was telling us about adolescents, the different needs that adolescents need during pregnancy, and then during handling their complications that happen when they're pregnant, and also discussing the mothers that are in the age group of 35 and above, and then also those that are between 18 and 34 that are considered a bit less risk. So maybe you can continue telling us some of the approaches you take when you're helping out these adolescent mothers.
The issue of adolescent mothers is really profound, and at least I should admit that many NGOs have developed interests and have come in. One of the complications, or I should say the problems that adolescent mothers face, like we said before, is social acceptance.
True.
It goes down to their mental state. It goes down to their financial state. It goes down to their ability to take care of themselves and whatever. So there is a lot of stigma with these people. No one is bringing them in. You find that even the partner that is with this mother is still not able. They may not be emotionally present because they're equally young in most cases, and they do not know what to do with the pregnancy and this woman and how she's feeling and whatsoever. So we identify them as a special group because they need emotional support. We sit them down and we tell them that, yes, the pregnancy was early, but it has happened. We just need to get a way of navigating around it. We go ahead to connect them to sponsorship programs. We go ahead to advise them on financial decisions. Put aside a pig bank. Prepare for your delivery. If our dear partner is leaving 2K at home, get aside 200 to prepare for birth. We still remind them, though this is to everyone, that not every pregnancy will go for the 9 months. It can still come out at 7. It can still come out at 8. And if you're waiting for then to prepare for delivery, then you've missed it out. You're going to go to hospital, let it be private or government, and you're going to be considered problematic.
Yes.
You do not have the resources. So it's just more of going personal with them, being empathetic, telling them, yes, the mistake has happened, but let's go around it. Going on to involve their partners. Call our husband. Let us talk to him. Let us tell him when you say, I can't lie on this side anymore, let him hope it will lie on the other side. When you say, I can't do all these house chores, I cannot manage, let him get a way of helping out. So the best we do, and I shouldn't forget that their bodies are not yet fully prepared to carry the pregnancy, to go through the experience of childbirth. And even after that, they're having a child. Their mind is not yet prepared to take care of this. They even do not know what, most of them, by the way, they do not know what to do. And if they do not have a mother-in-law to go to or an auntie to go to, they end up messed up. Like they just do not know what to do. There are high risks of cesarean sections
Among adolescents,
because their bodies
cannot hold the baby, cannot do everything.
Exactly, they cannot bring it out. If they have been able to have a successful vaginal delivery, we are having tears. The perineum is distorted. Apart from that, we are having the uterus is distorted. Like everything is just, it's like the way something comes to you unprepared.
True.
It is going to leave everything a mess. So even apart from their mental state and psychological state, their physiology, the physiology of their body is still distorted because everything is not yet ready.
Now, because you have spoken about, I can imagine because adolescents are young, their bodies are also young, so they are going through so many changes that are their bodies not prepared for. Now, I'm looking at also, because I can imagine between 18 to 34, your body is mature enough to hold the baby. So maybe there are less complications there. Now, let's talk about the older ones, 35 and above. Wow, we've heard that they are more at risk. What makes pregnancy at that age risky?
The good thing or the bad thing about bodies is that there is what we can call gradual evolution. As you keep growing, adding another day and adding another year, changes are happening. Just to go straight into the question, one of the issues that adult mothers are facing is egg quality. By egg quality, I mean women, we have eggs that are fertilized to bring forth babies. So by egg quality, there's something they call a mutation. Something just happens, something slight. And with genetics, something slight will bring up a very broad result. Like it is simple in the beginning, but the result is alarming.
It's big.
So there's what they call egg quality. Most adult mothers, because they have advanced with age, most of them have even gone through family planning. Most of them have worked under adverse conditions. We looked at those ones, okay, that have gone abroad to work. You know, abroad, if it is working, not joking around. We've looked at those that have worked in high-risk places. So your body has gone through a lot. And there are those things that change. They are slow, they are minor, but the results are big. Most adult mothers are not able to carry those babies to term. Most adult mothers can have a risk. It is connected to Down syndrome. I know they've heard about that.
Yeah, I've heard of it.
Most adult mothers have placental issues. Like the reproductive system, it has gone through very many stages. You realize, unlike men, ladies, every egg that you menstruate out is gone. And of course, the ones that are nearer are better. The ones that are further are compromised. So you have lost them over the years. Since 12, you've been losing eggs. And now the ones that are left at 35, you can imagine.
True.
This, a disclaimer, it is known to everyone. Because someone will come out and tell you, me, I gave birth at 38 and my baby is fine, my baby is intelligent and whatsoever. Yes, there is those that lie within the normal curve and there are deviations. These are not causes. When I'm outlining premature delivery, when I'm outlining placental issues, when I'm outlining Down syndrome, egg quality, whatsoever, I am not saying that you being an elderly mother is causing that. I am saying they are predisposing factors. Just like because of this, you are likely to have this. It is not a must that you're going to have it, but you are likely. So it is better to have our babies within this time, especially first babies, within this time, so that we eliminate some of those things.
So now we've understood some of those parts, things that we hadn't yet even understood about adolescents, what the changes our bodies go through, and with time we shall continue to have longer and bigger conversations about it. But and we shall have Madam Tina come back to explain more. If you have questions, continue to place them in the comment section so that we are able to come back with her and she will answer them. But my last question is one that I know, as Joan, I would ask a midwife if I was preparing to get pregnant. It's about pain. That's the one thing most single ladies, most first-time mothers, first-time new moms want to know before they even conceive. Which pain management, because we know the pain is there, which pain management options are there now in this time and era? We believe they have advanced. Which options are there for labor, during labor?
That is a question that all young mothers ask. Okay, not young mothers, young to-be mothers, like Joan. That is what they ask. Labor is associated with pain.
True.
Yeah, the pain is there, though to a smaller extent, it varies. Some people don't have all that much pain either. Yeah. There are those that are lucky, but there are those that the pain is over the head, like it's so much.
What I wanted, is there a way we can, the comfort measures that are there that midwives can give to reduce that pain? Because someone will be like, oh, me, I was having a lot of pain, but then my midwife did this and I felt better.
Okay. One, just to put it out of the way, what science has come up with before I go to the midwifery work is epidural. What they call an epidural is, it is a pain injection that you get as you're in labor. You start labor, they give you the injection, you go through labor completely painless. They just keep checking on you, and now they tell you it's time to push, and you push. No pain at all. But of course it is costly.
Does it have any side effects?
Of course there are side effects.
Is it this one that is administered in the spinal cord? Yes. Yes.
Yeah, that is it. Of course, with everything medicinal, there are side effects. With everything scientific, there are side effects.
And we have it here?
Yeah, we have it here. We have it. Women's Hospital, Mulago, they have it. At least that is where I'm sure. The rest private clinics, I'm not sure, but I'm sure it's there. And yeah, they're trying to bring it in so much.
And which other natural ways, if it's not medical, can we reduce or at least manage it?
Before you go to that side effects of epidural, number one, we have the baby can easily get tired. That's the layman language I can put. We call it fetal distress. Yeah, but it needs very good money. With good money, you can be fine. And then now the midwifery work, my mother cannot afford an epidural, or I do not have it at my facility. One of the things I encourage, one, we do this.
Rubbing me on the back.
We rub the back. It's more of massage.
Massaging.
Yeah, trying to alleviate the pain. And then one we encourage you to assume any position that you want. If you feel like kneeling down makes you feel better, please kneel.
Do that.
Of course, I have to ensure that the ground you're kneeling on is clean, because we don't want ascending infections. We encourage moving around. You move around. One, it will help the baby to descend into the pelvis, and you to put your focus off the pain. Because if you're sleeping or just seated, your body is now relaxed from everything else. It is focusing on the pain. We encourage when the contraction comes, just hold somewhere. You understand? At extremes, do we give painkillers? And our normal painkillers do not work for labor pains. I will take a Panadol.
So you have a special painkiller?
Yeah, there are those stronger painkillers that we can administer if it is really excruciating pain, like it is pain beyond what the mother can hold. Of course, you can at the time when you see, of course, the pain is as a result of contractions. So when I see that the contractions are very adverse and things are getting out of hand, we come in. But just what I do is to show you emotional support. We encourage our husband to be there, or whoever the attendant is, please be there. Tell her it's okay. You're going to go through this. It is fine. And the updates. You know, there are people, they are midwives or health practitioners, they will have an examination and then you're not telling the mother what is going on. Like, speak to them, tell them, okay, we have progressed to this, and they will know what to, how long am I willing to wait, So the best thing that we can do is to be there for you emotionally. And to tell you it is okay, you're going to go through it, you're going to make it, and to ensure that you are fine. Apart from the pain, all other things are fine, and to ensure that our baby comes out fine. Because I do not know what I'm going to tell you after going through the pain you have gone through and we don't have the baby. So I am there to ensure that you know that we are going to go through this together, and at the end of the day, we are having our baby. And usually, once we have our baby, you're going to forget the pain.
True.
Yeah, yeah.
Because the joy has come. Anyway, so we have come to the end of our episode, and all I can say, childbirth, anything concerning maternal child health, is so wide. We cannot complete it because there are so many questions that keep on coming to mind as we speak, and we shall handle all of them in the next coming episodes. But for now, please remember to subscribe, to like, to comment, to share with a friend, because this information is helpful to all of us, especially if you know you're starting up a family. It's good to know all this foundational information, foundational knowledge is always helpful. But thank you so much. Please remember to check out all our socials. We are going to leave them in the description box. We are going to check out so that you check them out, follow us, and get updates of everything that we shall be talking about. In case we are able to bring some live talks on Instagram, please follow us so that you do not miss out on such educative episodes and sessions with people like Christina.